They are very prevalent, and mental health is one area that is kind of underserved. I have always enjoyed taking care of children, and I love children and teens, and my strong belief is that if we can identify and target the problem earlier on, we can build more stronger, healthier adults, and take care of the problems in a better way. So I try to, preventive mental health and talk about mental health. And it's a huge need in help, like what you said, that there have been schools which don't have a psychologist on board, and there are schools, and even social workers, the school counselor, they can play a huge role in identifying those problems, like child who is in need, they have a loss, or they have been having problem with adjusting in the school or in the community. So we have to have that resource available.
Sorry, I'm muted. In your practice, when you're seeing your patients, like who are children, do you deal just with the children and their parents, or do you also sometimes talk to the school professionals and their teachers? Do you ever communicate with their school environment as well?
Absolutely. Being a child psychiatrist, there are not many child psychiatrists in the area, and it's not an easy job to do, because you have to interact with the family, you have to interact with the school. With the resources available, it's not as much possible as I would like to, but teachers' input and school counselors' input is very, very important. Some of the diagnostics we cannot complete without the teacher's input either. And there are always, like, parents. I have a couple of children right now who are very sick, and they cannot go to school, and they are having a pushback from school. The school is having hard time adjusting to the needs of the child, because child doesn't have fever or anything, child is anxious, and they get more anxious when they go to school. So I have been in communication with the school that they need a break, they need some change in their curriculum, or change in their environment.
Gotcha. Okay. Well, for a lot of people watching or who will watch this recording later, I think on a lot of people's mind when it comes to children and their mental health is COVID. With the past year of being so isolated, I think as adults we're probably still dealing with that ourselves. I know I'm kind of dealing with that myself as a just being out, and I got my vaccination about a month ago, so I've been out in public a little bit more. And it's been, kind of a shock to the system a little bit, and it takes some getting used to again. What have you seen in your practice about COVID and how it's affected children? Have you seen
Absolutely.
anything consistent with COVID and how it's affected children?
Absolutely, absolutely. And with COVID, we have noted there have been some. In the beginning, it was different. It was good change that people were staying home with the family. My parents were staying home, but when you look at it, there have been so many changes in everybody's lives. Not only us as adults, but imagine children. Everything is changed. Their schedule is changed. Their life is changed. There is so much unpredictability. There is fear. They don't have a routine. They have to do online school. They are more isolated. They cannot interact with their friends. They cannot go play outside. They cannot participate in those games, sports. They cannot let their energy out. So there is a huge different challenges to parents and to children. Not to forget about, one is the social aspect. Then the other one is like staying at home. Children are being exposed to different things, different stressors that parents had. Now children are more in tune because they are 24/7, they are around parents. As parents, sometimes we don't realize that the child is noticing. Maybe parents are arguing, or parents are having financial difficulties or health issues, you name it. But so parents are not aware of it sometimes, and I see children are more in tune, and they are taking all that unnecessary stress more than before. When they used to go to school and parents used to go to work, there were outlets for those stressors. Now they're all cooped up in these houses, and we as humans, we are social animals, so it's really affecting parents, and then it is affecting children. Another aspect is the fear. what is going to happen to my parents, what is going to happen, how the infection is going to affect me or my loved ones. And it's a huge burden for the children. And watching the news and what when my school is going to be opening and what will happen. So I have seen a lot of anxiety, a lot of depression, which presents in different ways.
Yeah, yeah. I noticed with my own children. My children stayed home last spring, and then into the fall they stayed home. And then we decided to send our children back in late fall last year, and because the school looked like they were doing a lot of good, good healthy things and keeping things very
Mhm.
safe. And we noticed a very fast difference with both of our my children who are 9 and 7. They seem to be a lot happier going to school again and interacting with more children again, which we didn't really expect. I mean, we didn't really think our children were depressed necessarily, but then when they started going back, we noticed it was a huge change. And I know it's so unpredictable now, but now that we're going back out of the open now, what do you have any predictions or foresight on what's going to happen with all these children who are going to be out in public again? And I think about how much of their lives have been under COVID now, because if you think of a 9-year-old, a year is a ninth of their life, or a year for a 7-year-old, a year is a seventh of their life. And for us, it's a 41st of my life, so
Yes.
it's a totally different dynamic mathematically. And I was watching like a concert the other day, and there was like 20,000 people at this concert. And my daughter said, I've never seen so many people before in my life. And I don't think
Yes.
she had remembered seeing a crowd like that.
Hmm.
What do you think is going to happen? Do you have any kind of thoughts about how we can guide our children back into normal life as we vaccinate ourselves and get back into public life?
I think it's interesting you say normal life. We don't even know where that norm is yet. We are still not sure whether this will be our new norm, or that's my personal opinion. Like, there are new strains coming. Look at the world around us. New strains are coming, more virulent, more infectious. So still, we have to take cautious, and we have to be careful. We have to be cautious, and we have to be vigilant. What if the infection comes back again? We don't know. And like what we were told, that every year we would have to take it, like flu vaccine, we will have to take the vaccine again. Now there are talks about having a booster. So children's behavior, I think as adults, I would suggest that we have all these stressors. I hope we don't convey all these things to children. So the biggest thing, but because unpredictability, it's a lot of fear, a lot of anxiety, a lot of stress, and then it leads to depression. So we as adults should be able to contain ourselves and then help our children, provide them a predictable, consistent environment. I think if as long as we can provide that, we can decrease their anxiety and depression and stress.
Hmm.
So I feel that could be very stressful. It would be exciting to go back. I have seen both ways. Some children are loving it going back to school, and some children are getting so stressed they have gotten back to online schooling again.
Yeah, how do you think parents and educators and everybody in the community can do that, can guide kids back? Is it kind of like what you were saying, with just be careful what kind of subjects you're discussing around the children and making sure they're not stressing the children out too much? Or is it just making more routine and consistency, which I know as an educator that children thrive on, and they love that? What do you think is most helpful for them?
I think all of the above. I would say, like, children are growing, and we as adults have to provide them the nature and the nurture, and we have to provide them this nurturing environment. Yes, it is unpredictable for us, but if we can give them a routine, a predictability, and avoid unnecessary stress. I'm very big on, like, I don't think children should be exposed to our news all the time. Yes, they should be informed. They should be informed of the facts. We cannot keep them blinded, but that information should be filtered by us. They don't need to hear all the facts all the time. That causes a lot of stress and a lot of fear and anxiety. But we should filter that. And I think that could be preventing them from unnecessary stress and extraordinary stress, which is COVID, mathematics, and the predictions, and all these numbers are causing. I cannot watch news all the time. It causes me too much stress and fear.
Right, right, yeah. And when we take a step back from COVID and we think about Well, you mentioned that the normal, never was normal. I mean, we always had children who needed mental help. They had maybe have mental illness, or they have a lot of difficulty in their lives. Maybe they're the child of abuse or past abuse, or ongoing abuse. There's all kinds of scenarios where even in quote unquote normal times, the students are under a lot of stress. What do you wish that parents would know about those normal times? You mentioned a little bit about the routine. Is it the routine that the students need, and maybe monitoring our own stress as adults, and monitoring our own things that trigger us to be stressed,
Absolutely,
that will
absolutely.
help the students? And what else is there?
Absolutely. Like as adults, I think first of all, we have to take care of ourselves to be able to take care of our children. I use the analogy of when we take the flight on the airplane, they say first put the oxygen mask on yourself and then to the child. So if we are stressed, if we are depressed, we are anxious, we need to take care of ourselves to be able to give them the healthy environment. And I think the biggest thing is to watch what we are providing them. During COVID, what biggest thing I saw was because of lack of socialization, lack of outdoor activities, children were getting into online, social media use, internet use, online use, electronic use. So I feel that should be limited. uh, Basic things should be taken care of first. They are eating healthy, they are sleeping, they have a routine, predictable hours. No matter, even if you are working from home, we should keep a healthy routine. Then we should encourage children to have some good healthy hobbies. They shouldn't be only hobbies, should not be playing games and video games. I'm personally big on, I educate all parents and I tell them blame it on me that I limited the use of electronics. Don't let them. That is kind of instant gratification, and it is not very creative world, where they are playing video games and all that. So another thing could be like we should, go for walks, go explore nature. It is safe to be outside, and this is during COVID. But beyond COVID, even if we provide a warm, fuzzy home environment, I know children are, very sensitive and they are growing. So we as adults are supposed to provide them these calm and nurturing environments, which meaning they should be able to feel safe, come to us as adults. They should be able to talk about their thinking, even if they're depressed, if they're not depressed, if they're uncomfortable, if they're bullied at school, if they're mistreated, if they're abused. We as adults have the utmost duty to provide an environment where they feel they can come to us and talk to us. And we should not be in a mindset that my child cannot have this, because mental illness it is not um, it doesn't leave any race or any color or any socioeconomic status. Anybody could be affected. Any of us, any of our children could be affected. So we should have an open mind to be vigilant, to watch for the symptoms. It presents in different way in children. Child might be depressed, but their behavior would be different. It's not easy for children to tell us that, oh, mom, I'm depressed. We don't hear that. We see change in behavior. So, and as long as we are watching and we are observing their behaviors, if there is a change, they're not going out with friends, they are irritable, they're not eating, they're not sleeping properly, they are lacking their schoolwork, they are not lagging behind in their work, we should be paying attention to those things.
Okay, so I didn't prepare this question, but when you went off on that part right there, I thought about all the times I asked my children how was school, and what do they say? They say fine, right? And because when
True.
I was in school and my parents asked me how was school, I said it was fine, you know. And in middle school, I was getting bullied sometimes. I mean, I was not a happy child. Sometimes just like a lot of children aren't happy, and I was very reticent to talk about that with my parents.
Of course.
Maybe as a boy, I felt that I should be tougher and I shouldn't be being bullied. Maybe girls have their own feelings about being bullied as well. How can parents break that ice, break that wall to have students their children open up, so at least we can try to diagnose what may be going on, if there is that some kind of change in their grades, or some kind of change in their
Right.
mood or something that? How could parents do that?
True, but I think as I mentioned before, also like there is so much overlap. Like it is hard for me to concise it in one answer. One thing leads to another, and my thought goes to another thought. That the most important thing is the parents being receptive, not being judgmental, not being in denial. I think we have our own struggles, and children are very sensitive. They pick on our body language, on our gestures, on our demeanor. They are very sensitive, and that makes them facilitate that talk or inhibit that talk. So we have to be careful, provide them this open space, safe space, I would say, that it is safe to talk about anything they feel like, which is not easy, because many times we feel my child cannot be depressed. My child, it's okay. It can happen to anybody, like diabetes. It's not my fault that my child is depressed. We have to have remove that stigma, from our own self, and then we will be more open, I think. So as long as we provide them a warm place, safe place, I think our children can come, and we not be judgmental. Biggest thing children have is that they feel parents are lecturing me, or parents are judging me. And so if I think that should be the biggest thing, if we can do that.
Okay, interesting. Now, as far as what the community can do, we just had our election this weekend locally, for ISD and cities, and some are still going on. So, community is heavily involved in health when it comes to being local, like cities and counties. We have a lot of interest in health, and even being an educator, when we had bullying instances between students, even if the bullying was taking place at home online, we got involved. I mean, the school had an interest in getting involved in that, because of course it came into the school and it affected the school and it affected learning environment. And so we would get involved. And so I wonder what would be your advice for how the community at large, not just the school, but even the city government or the county government or anybody, whether it's a nonprofit or anyone, how could they get more involved with children's mental health, and take action to help on children's mental health to improve it?
I feel the biggest thing is the awareness, mental health issue of awareness. It's a huge thing that if you are aware of something, you can identify it, and then you can solve the problem. So, number one is awareness, and then acknowledging it, that okay, it's a problem, and then asking for the resources. So there are resources. However, we are limited in resources, but if we have some funds dedicated to these, these ideas, then we can, of course, deal with them. So children need nurturing environment. Community could be nurturing, and if we can develop some, children should be educated about giving and volunteering, taking care, developing empathy. I think if they lack empathy, that is which leads to all these problems. Then they are not empathetic to the other child, their color or their race or their socioeconomic status, and that's when they bully each other. And many times I have noticed um, that we have to identify why the bully is doing the bullying. It's not a simple problem that some child is mean and they are bullying other children. Those children are also many times hurt. So as soon as we identify the problem, we have to address it, identify the bully, why is he bullying, and then go to the bottom of that. What is the root cause of why they are bullying? And I have seen it a lot of times. Neglected children, abused children, they don't know how to be nice to others because they were abused and they were, mistreated. So it's a
Hmm.
complex problem. Number one will be identifying it as soon as possible, and then we can take care of it. Many times, what I see when a child comes to me and they tell me they are getting bullied, they're afraid. They don't want to tell the teacher, they don't want to tell the parents because they're afraid they will be, called that they are tattletales, and the bully would found out, and then they would be more hurt. So
Right. Yeah.
awareness. I don't know what you are guys are, what schools are doing. I hope schools are educating, because I'm seeing bullying has gone to a different level, different extreme. It's and younger children are doing it. First, I used to see it mostly in high school. Then it became middle school. Now elementary school kids are like they are saying some nasty, mean things to each other,
Mhm.
unfortunately.
Yeah, yeah, and we had already talked about having those resources in schools is really important. Like having a therapist or counselor or even a psychologist or psychiatrist in the school would it makes a tremendous difference. I've seen it myself with my own eyes, having that person in the
Hmm.
school. It was Miss Epec when I was at my school, and it makes a tremendous difference. And you mentioned with the bullying part of it, um, the schools are taking a different tack, which maybe you're vaguely aware of, or maybe like you have a lot of knowledge about it now, and that's the importance of social and emotional learning. Schools are really taking an interest in social and emotional learning now. Nowadays, it's kind of like the hot topic with schools now. I think it was happening before COVID. Honestly, I know my school district had started those efforts, and now it's even more important as well. And
Absolutely.
some of the techniques are what you described: teaching empathy, teaching communication, teaching the importance of talking about feelings and talking about how they're feeling, and
Hmm.
socializing, and the importance of being around other people. And so that's actually happening a little bit in schools. And I wonder if you had seen that in any of the patients you've had of because it's kind of haphazard. We're seeing it in some schools and some are not, but it seems to be increasing and growing as a priority for schools.
Hmm. That would be a great change because children are spending so much time in school. To be honest, I have yet not seen that difference. But this year, last year was not a normal representation of anything. So mostly focus was most depression, anxiety. Most children were stressed because of online school, and most parents were stressed because they were home with the children. They did not have, luxury. Some of them have lost jobs. Some of them, they didn't have the luxury of having a babysitter with the children while they are working. So that kind of stress, it was a totally unusual kind of factors which were, contributing to children's stress and parents' stress. But that would be a huge improvement if the schools are working on that. And because that's what I notice. I feel children empathy is a huge thing. Communication skills are a big thing. If the schools can designate some time and dedicate somebody who can teach them. On top of that, like healthy habits, healthy boundaries, being respectful. I know schools do that, but not to the extent where it can counter the negative effects and negative bullying and factors like that.
Yeah, yeah. Well, something's definitely better than nothing, because I mean, I grew up in Texas schools in Fort Worth, and great teachers, great schools, but I don't think we had any of that very intentional teaching about the topics we're talking about. So really, really important. It all goes back to education, I think, and like you said, being aware of these issues and understanding even the basics of them. And
Mhm.
you've really helped us with the basics today, Dr. Chowdhary. I really appreciate it. These are some insights which I hope that the people watching can take forward, and perhaps some other time we can get even more into depth into some of these issues. Like you said, it's a complex issue with complex causes and complex solutions. It really depends on the students and or the children and what they're going through at any given time. And so I'd love to delve in a little bit more with you some other time too. Um,
Absolutely,
yeah.
absolutely. But the message we should take from this discussion should be that schools have the most important role in child's life. So if we can teach them these basic things in schools, we can look forward to having healthy adults.
Yes, yes, absolutely. Yeah. Well, Dr. Chowdhury, I really appreciate your time today. I think you've
Thank
helped
you
a lot of
very
people
much.
watching. Thank you so
Thank
much
you
for
very
joining
much for
us.
having me. You take
Okay.
care.
All right. Thank
Thank
you
you.
very much.
Bye.